Hi lady, do you seek to settle on a particular contraceptive that will prevent pregnancy? Let's talk about the various family planning interventions and drugs, how long they protect you, and their possible side effects. This is Modern Natural Clinic with your servant Emmanuel Anayobo Siema, your lab scientist. Please subscribe to the channel, like the video, and follow me before I kickstart. The first to highlight is the irreversible or permanent intervention where a male's sperm duct is cut or removed in a procedure called vasectomy, or in a female, the fallopian tube through which egg travels into the uterus for fertilization or implantation is cut or removed in a procedure called tuber ligation. Please be 150% sure that you are done with bearing of children before you go in for either of these procedures, because they are a journey of no return. Next are the long-acting but reversible interventions like the insertion of a rod-like device under the skin of a female, which protects her for up to 3 years. This releases hormone progesterone, a man-made progesterone hormone, which stops ovulation in the female. Under this are devices that are inserted in the uterus of a female, IUD, intrauterine devices. Some are hormone producing, whereas others are very safe, like the copper IUD, which is hormone free. This is safer but has a side effect of extending a female's menstrual period. This relatively may make your flow heavier compared to previous. Copper IUD protects the female for up to 12 years. In the course of the period, you have regular menses, but you still may have irregular spotting. The copper kills every sperm that flows from the man into the woman and also makes the inside of the uterus unconducive for implantation, even for a fertilized egg. The third is the natural or behavioral, in which the female studies her menstrual cycle to note danger periods. This I'll be coming up with a video to assist females how to go about monitoring your menstrual cycle, to note danger periods, how to go about it, as well as the factors you cannot ignore. Under this is the withdrawal method, to which most women have no confidence in the men. Then the next is the barrier method, in which a female may seek to use a device which is inserted at the cervix called cervical cap. The female may also want to apply a cream in the vagina area, which is spermicidal, meaning they kill sperms that are inserted into the female. Then the ultimate, which is the use of CD, condom. Aside from the fact that CDs prevent pregnancies, they also prevent sexually transmitted infections like gonorrhea, syphilis, hepatitis B, C, HIV. The next to highlight are the emergency contraceptive pills, which are the center of today's video. They are a major concern because they are easily accessible, they are convenient, and can easily be administered. As a result, our women constantly abuse it. It contains a hormone-like substance called levonorgestrel, which also prevents ovulation. And please note, anything that contains hormone or disrupts the hormonal production in the female with regards to ovulation, you should be very much particular with. For the female to ovulate, the body tells a portion of the brain called hypothalamus to produce a hormone called gonadotropin releasing hormone. The gonadotropin releasing hormone also goes to the pituitary gland, which urges this gland to produce two hormones, LH and FSH, luteinizing hormone and follicle stimulating hormone. Listen, woman, your portion of the fallopian tube, the ovaries from which you produce the eggs, is what you call the follicle. So if a hormone is by name follicle stimulating, then you know exactly the function of this hormone. It's this process all hormone producing contraceptives disrupt, and for that matter, you don't mature an egg from your ovary, and so you don't menstruate or ovulate. This leads to hormonal imbalance, which brings about the various side effects, including irregular menses and spotting, infertility due to ovarian cyst formation, also known as fluid-filled ovaries. Please, who can we blame? for the indiscriminate use of emergency contraceptive used by our females? Is it the female or the man to be blamed? Please let me know in the comment section, man or woman, and let's meet in the next video.